In terms of the specific problems that I think we're having with communities of color around the country, there's been a lot of attention to vaccine hesitancy, understandable vaccine hesitancy among lots of different communities of color for lots of different reasons. And clearly that has to be some piece of the puzzle. But it does also feel like there are barriers to entry in terms of how you get yourself a vaccine appointment, how you get your mom or your dad a vaccine appointment or some other elder in your community, how we sign people up, how we ask them to come to sites where vaccines are available. And it does seem like you've cracked that code a little bit.
Yeah, so kind of going back really quickly, you mentioned why are we effective, and are we actually delivering vaccines to people who are in most need, particularly communities of color, Black and brown, where the heat maps show the highest rates of COVID infection are. When we look at how it was distributed in DC, or you look at Chicago's maps, and then you showed us the maps of Los Angeles, we really wanted to prioritize the most vulnerable here in South Los Angeles. So our first mantra was, we need to put on our oxygen mask first, and then we were going to make sure that we turned to our neighbors and made sure that we offered them this life-saving essential medicine. So we actually vaccinated our 300 to 400 employees. And then we went to Black and brown healthcare workers throughout South Los Angeles. And they really didn't have places to turn because they're not part of large health systems. So we really became their safe haven, their safe harbor to be vaccinated. After that, we said that's not enough. We weren't in it just to vaccinate ourselves. We really wanted to make sure that we can get to every grandma and grandpa, every vulnerable senior, every essential worker that needs it when they are eligible. And so that is the commitment that we've made to kind of get to where we're at. But of course, just not enough vaccines. So at the end of every day, it's just this constant struggle to try to get through the day. And we work so lock and step with the county to find expiring doses. Our mantra here at Kedron is no drop will go to waste. And we make sure that every drop goes in someone's arm. But that needs to be our seniors. That needs to be our Black and brown healthcare workers. It needs to be all of our healthcare workers. And then there are times we have expiring doses and we don't have folks lined up. And that's where we're partnering with politicians' offices, community-based organizations, faith-based organizations. We need to figure out better ways to get those who are shut out. And that's where our solutions came in, making sure that there were workarounds for the website, workarounds for not having a cell phone, not having email, maybe not having a driver's license because you're an undocumented worker or an undocumented grandma in this community. What if you don't have a car? We live in an area where predominantly our patients don't have access to transportation. We made it very clear that we were going to be a walk-up site because not having a car should not be a barrier to not getting a vaccine. Not having an email and not having a phone is not a barrier to not getting a vaccine. Not having internet is not a reason to not get a vaccine. And Kedron here, we were so focused and committed to overcoming those barriers. But we've also been very positive. I think the optimism that you feel and sense and you see in the stories, we've got music, we're dancing, we're happy, we're smiling because we know that this is the solution to overcoming this epidemic, to reopening our economy, to getting back to work, to getting back to loving our loved ones and hugging and all the things that we did before this epidemic began. So we're actually joyous every day that we can be a part of the solution. We just don't have enough vaccine to do the job and do it the best we know we can.
Dr. Jerry Abraham, the man in charge of Kedron Community Health Center's vaccine distribution. Thank you so much for your work in helping us understand it. Thanks for being here tonight. Good luck to you and your colleagues.
Thank you so much, Rachel.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.